Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning. Good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. And today we're going to be talking about businesses who have employees and benefits that you need to be providing them. And I know we've got a lot of solopreneurs out there, but y'all are going to grow. And we want you to know that when you start having employees, there are some very, very specific and special things that you need to do to make them want to stay and provide great things for them. And so please join me in welcoming Jeremy Vesta to our program today. Welcome, Jeremy. How are you?
Doing great. So glad to be here, Deb. Thank you for having me.
Cool. And in the pre-chat, I discovered that Jeremy lives in Fort Collins, which is where I'm from. So this is just happy, skippy day. So let me tell you folks a little bit about you, and then we will jump in. So as I said, today's guest is Jeremy Vesta. He is the Chief Financial Officer of Curally. With his background as an economist and a wealth of experience in business leadership, Jeremy is passionate about helping companies optimize their investment in their most valuable resource, their employees. Through innovative strategies, he empowers businesses to create a thriving and productive workforce. In today's episode, he's going to share his insights and expertise on how to optimize investments in employees. So again, Jeremy, welcome.
Thank you so much. Yeah.
Well, I always like to know how my guests got to where they are today. So tell us a little bit more about your background.
Yeah, and it's a weird story. It starts in manufacturing, which you would think when it comes to healthcare innovation, employee benefits innovation, manufacturing is a very difficult environment. People usually are just trying to get ahead of their workers' comp claims and things like that. But we had a family business in Green Bay, Wisconsin, and it ended up being national. Very successful, very hard work. And we wanted to give something back to our employees. So it was kind of the era when concierge type stuff was just kind of creeping up. And we brought on a medical director, and he's with us today. He's still one of our medical directors. And we kind of worked on a concierge type product with a local healthcare provider. And it kind of blossomed from there. We brought on nurse condition managers. We got involved in some of these cases. And because we kind of cared about these employees in a deep way, we invested quite a bit and started improving their health, started changing their lives. Well, along the way, our CFO at the time came in and presented us with the financials about 4 years later. And we were expecting this had to cost us something, right? I mean, this was very expensive. We're bringing in medical expertise, we're doing concierge service, all this stuff. And we found out that at a time in that area, medical trend was about 7 to 8% annually. Net to the beginning year. So the baseline cost, we'd actually saved 25%.
Wow.
On our healthcare costs. Very dramatic. We had control over a lot of other things. Obviously we could push employees into this program and all of that, but we found that by taking care of the utilization, by taking care of our employees, we managed to save a ton of money on our healthcare costs, but also these people were happier. They were more productive. We saved some lives. There were lives that were in jeopardy. And you talk about retention and all of those issues that every company struggles with. You tell that story and it's a big deal. So we all of a sudden quickly recognized, wow, this could really be a business. And, there's a little bit of a heart in it for us where we want to take this out and help other people do what we did. It's not just for us. This is to share with the world. People are struggling with the healthcare situation in America right now and globally. And they don't have a lot of answers. You're either
Mhm.
experiencing in some parts of the world excruciating wait times for services,
Mhm.
or you're paying through the nose
Right. Mhm.
for what you're going to get.
Mhm.
Your employee may just pay the deductible, but the
Mhm.
health plan knows the
Mhm.
costs are
Oh yeah.
very high for
Mhm.
some of these things.
Mhm.
And so it quickly snowballed from there, and we put this together as kind of a mission of our heart, and
Mhm.
as a way that we think this is the way to change healthcare. We
Mhm.
think this is the way to change employee
Mhm.
benefits, to finally produce a product that impacts your employees, as
Mhm.
opposed to just giving them window dressing or some nice little discount at a gym,
Mhm.
which is great. Those things are
Right.
all
Mhm.
good. They're positive, but they don't really
Mhm.
impact anything other than the very slightest
Mhm.
margins, right? So it was just an unbelievable story, and had to bring it
Mhm.
to the world.
I love it. Well, it is so true that when the employees are happy and feel like their employer cares about them, they are much more likely to stay. And one of the other things that we see and we hear about all the time is the benefits that employees get they're often more important or as
Oh,
important as their salary. And I think we're, what I've been hearing now. I'm a solopreneur. And but what they've been talking about is the fact that the millennials and even younger, the benefits are truly what they're looking for. They want to make sure that their families have insurance. The whole work from home thing is obviously something that has obviously made a big change in our world. But it is something that it's just important all the way around. When you're hiring, to be able to say, hey, we offer this benefit and this company over here doesn't. And so when people are comparing, they're going to look at that and go, wow, this is so important. And so one of the first questions I have is, how much has COVID changed some of these things, with what people
sure.
are looking for?
Yeah, I think this stuff becomes way more
Mhm.
important because everybody got anesthetized a little bit with the
Mhm.
first impact of COVID, which
Mhm.
was, hey, naturally some of our consumption went down. Oh,
Mhm.
my healthcare costs in my plan for this year
Mhm.
were lower.
Right.
Well, yes and no. Or they stagnated.
Mhm.
It's like, but then
Mhm.
came 2021 and 2022,
Mhm.
and all of a sudden it's an acceleration
Right.
because those people that couldn't get in,
Mhm.
not only did they not get in to get their procedures they
Mhm.
wanted, some of them were elective, some of them
Mhm.
not, whatever, but the complications from not having those on
Mhm.
time created much more expensive
Mhm.
situations across the
Right.
board, and you're
Mhm.
seeing this massive acceleration. Not to mention, we lost a tremendous amount of doctors
Mhm.
during that time. A lot
Mhm.
of them retired, a lot of them gave up. We lost
Right.
nurses.
Mhm.
And so there's just not, as the economist in me
Mhm.
says, there's not the supply of these
Mhm.
resources to bring the costs down.
Mhm.
So it becomes even more important now to be looking at utilization.
Mhm.
And when I talk about utilization, I'm talking about each episode or each unit of
Mhm.
care that you're going to get billed for, and saying, how can I affect that?
Mhm.
Every plan goes in and tries to negotiate some kind of discounts
Right.
with their
Mhm.
provider, or you're hoping that your
Mhm.
increase isn't that much this year.
Mhm.
That's important.
Mhm.
That stuff
Right.
matters. But if I can just consume less
Mhm.
in a large way,
Right.
and the interesting fact about consuming less is it's not a large percentage of your population.
Hmm.
You're talking about 20% of your
Mhm.
population driving about 80% of your cost.
Mhm.
So when you bring in a service like Curally, we come in and we're going after the very risky. We're not going to
Okay.
manage necessarily right away and expend resources
Mhm.
that you're hiring
Mhm.
on people that are not generating claims. They're young, they
Okay.
might have some health issues, they might need some management at some
Mhm.
point, but they're not the priority right now. We're
Mhm.
going right for those complex cases.
Okay.
We're going for cancers, we're going for
Mhm.
people with multiple comorbidities.
Mhm.
They're on 15 to 20 drugs,
Mhm.
if you can believe that. Things like that.
Mhm.
And so in the modern era, all of these little pieces become even more
Mhm.
important post COVID.
Right.
where it was important before. Now you're seeing it accelerate. And this year, I'm trying to remember what Milliman predicted, but it's staggering. I think it's 8%, back to what we were experiencing in the 90s.
Right.
Very significant increases on top of already expensive plans. And I can even remember back in the day when there was no copay and no deductible on certain plans for certain employers.
Oh,
right. Right. Like you just consumed your health care and it was covered. You paid your premium and that came out of your paycheck. Those days, millennials and zennials have very little, if any, experience with that.
Right. They're used to a copay. I mean, that's
they
just,
have a copay. They've got a deductible. It's expensive. Every time they consume, there's kind of this share, which from an economics perspective is smart. You have to send the signal back, but it's not curtailing their consumption. If they have an issue, they're still going to do it. And they don't have an understanding, right? There's no knowledge base amongst these people to make solid decisions. Everybody goes online and Google searches what they think their health condition is, but it leads to really no
Dr.
outcomes.
Google is such fun, right?
And you still end up in the ER, and then you end up admitted, and all of those things. So you're looking at that cost, and how do I give a benefit back that's reasonable at a time when it feels like the industry is just chipping away at that bit by bit. Making my healthcare costs increase, making me want to put more of my deductible, increase the deductible to my participants, to my members, increasing the share of the costs that they're going to pay in the premium, all of these things. Well, you have to get after the utilization. You have to bring in some expertise. And there's not a lot of options out there right now, which is, good for us, not necessarily good for everybody else. But that's where our expertise comes in. You bring us in, we can drive down utilization. We will make these people healthier.
So you have a flu clinic, things like that.
Well, no, I mean, honestly, and that's a misnomer. On-site clinics drive utilization.
Oh.
And why do they drive utilization? Because the referral rates at on-site clinics, because they're usually nurse practitioners or physician's assistants. There's a lot of things they don't feel comfortable with.
Right. So they're going, oh, you need to go out
at a much higher rate than a regular clinic.
Interesting.
So it's actually driving more utilization. So when we have conversations with customers that we have real strong relationships with, those are the things we actually tell them. That might not be the best thing. I know you invested $1 million in this clinic to set it up, and I know you're paying for it every year, but it's treating cuts and scrapes. Those people can take care of that themselves. Right. They can get to urgent care. They can get to their primary care.
They can put their own Band-Aid on.
Nothing critical is ever going to get dealt with in those clinics. And what's going to happen is for the people that are fearful, that have issues, they're going to get referred out, and you're going to have more tests. You're going to have more of the high dollar items. So you bring in a group like us that's looking at your claims, finding out who actually has the issues, looking at your biometrics, which you're probably paying for, but not able to action on. Because you just have this data sitting out there, and without anybody having conversations with people, nobody does anything with it. It's like, okay, I get it.
Well, and you have the weird anomalies like, COVID.
Right. So you bring us in, we work through that, and then we deal with those very complex people, which are driving most of your cost. You're talking about the top 50 to 100 employees at the beginning.
That actually is me.
Right.
And, and we didn't even chat about this before. I'm on my husband's plan, which is a large company. And in 2015, I was diagnosed with stage 4 breast cancer. And if it can go wrong, it has. I'm still in treatment. And several years ago, they went to my husband and they said, you guys are the biggest claim. Out of and they have thousands of employees. I was like, oh, yay. I'm not sure I want the medal for that one. But yeah, it's now we're very fortunate because it is a very large company. And so they can absorb me, and the other problems.
But they'd rather not. If there was a better option, they'd like to have that expertise. And that's the thing. When you're getting into these conditions, it feels like, well, I'm seeing an oncologist and they're doing everything they can. But the variability in care, the variability in outcomes, the variability in costs across the spectrum of doctors is mind-blowing. It makes sense when you get into it, because there's it's a very opaque market. There's not a lot of price discovery when you're dealing with medical costs. So you charge whatever you can get away with, I guess, right? It is what it is. But you bring in an advocate, you bring in somebody that goes to your doctor's appointments with you, you bring in somebody that knows the system, has dealt with these complex conditions, has dealt with stage 4 breast cancer, has dealt with very complex autoimmune issues and things like that. And then they start to put the pieces together, and you find out that the coordination of care, that's where a lot of the issues are.
Well, and even just making sure, you talk about 10, 20 medicines, making sure that, because those are not coming from one doctor usually, right? They're coming and
correct.
And
never.
so
Almost
just
never.
making sure that all of those go together and play nice, because you can have ones that are contraindicated. You can have ones that, just totally block out the other one, or you can actually make you sicker. But nobody has sat down with the sheet of paper and gone, you take this and this and this and this, and
Well, yeah, we can go through some companies' claims data and quickly see, hey, there's a huge percentage, there's a huge number, let's say, of ER visits that you've got that were totally unnecessary, because I know they're drug reactions. So this doctor who's treating this condition didn't talk to this doctor. You have Epic. So they're technically sharing all this data, but it doesn't really get shared.
But if you're like me, the Epic thing is like a War and Peace novel.
And your doctor is not going to sift through it. They're not taking the time.
Well,
and without
especially if
having
you've
some
gone
expertise,
into urgent care or an ER.
Oh, for sure. For sure. And so having a group like this that's rationalizing those medications for you and saying, nah, this doesn't really work with that. I'm going to go talk to this doctor. Are you aware that they're on this and you're prescribing that?
Right.
Simple things like that you think should happen in the medical arena just don't happen. They're still not happening. We've put all the tech in the world at it, and it's still not happening. And there's a human aspect, because when you're dealing with employees, right? They don't know what questions to ask. They're scared. The majority of people that we deal with, especially within the chronic conditions, when you're talking diabetes, hypertension, cardiac, renal, they have collateral mental health issues. And those are the barrier to them making improvements. So if you think that you're going to have, a nurse make a phone call to some individual on the plan and say, hey, are you taking your meds? And that's going to make a huge impact on your life. I think you have another thing coming. This takes a lot of legwork. This takes a lot of authenticity. It takes real relationships, and it takes face-to-face as much as possible, one-on-one. Because you got to build a relationship. You got to build trust with these people before you're going to impact their
I'm not going to tell you I take all that,
No.
and a lot of it is, it's also requires knowledge. Now I take 3 pills. I mean, all this stuff that I have, and I take 3 pills. But I also take a lot of supplements. And so I always have to remember to tell them, here is what I take. Here's the dosage, because, just because it's not prescribed doesn't mean it can't cause a problem.
Exactly.
And I think, and then of course you do have people who, they don't want to admit that they're taking all of that, and all sorts of things. And then that's when they're doing I have a doctor here and a doctor here and a doctor there, and they're never going to talk to each other. So that's okay.
No, by the way, I like my oncologist. He's a nice guy. Well, what does that mean? Okay. I would prefer to have the best oncologist, even if he, maybe doesn't have the best bedside manner. That's really what's important. What are his outcomes? And, the information that's available to a patient, a prospective patient, is all quality data. There's no hard data as far as efficiency or skills or anything. It's all, do the patients like this person? Or this is the oncologist I got referred to, so he must be good. You don't know that. Your primary care may have a relationship with this oncologist and know nothing about the other oncologists in the area. Again, you bring in our expertise. All of a sudden, we're sitting and talking with you and saying, boy, I've had a conversation with your oncologist. I'm getting the sense that he's not up to date on some of the most advanced things. We have connections with people that are on the absolute forefront of a lot of this research. Would you mind if I did some research and maybe sought out somebody else? And usually because we've established the relationship and they're relying on us, we can get that patient, that participant to a doctor. For instance, we had an example. This was a wonderful example. This lady was stage 4 cancer, metastatic cancer, not a curable cancer. And it supposedly, right? So that was the thing. So she was on a maintenance treatment that basically was a holding pattern until she died.
Just waiting.
So from a quality of life standpoint, terrible. From a productivity at work standpoint, terrible. From a cost perspective, we're talking about $500,000 a year on a drug that's not going to do anything.
Right. Or might be making it worse.
Right. Might be making it worse. We got into their claims. Our medical director got into the file, had a conversation, and then said, you know what, the cancer, I don't know why you think this isn't treatable. It's located in only a few areas.
Right.
Why don't we go for an ablation? And so we took that individual, we took them out of network to a more qualified oncologist and surgeon, went to the company, got permission, went out of network. So it was going to cost a little more for the surgery, but a full cure. The individual is currently still in remission.
Holy cow.
And didn't even, didn't even need the maintenance chemo. Everything's great. Went from metastatic cancer and thinking she was going to die to now she has a completely different outlook on life. You can't possibly have a better internal marketing campaign.
I know, because she told everybody that she worked with.
Everyone.
Everyone. Well,
everyone.
And, there are obviously negligent times, but in many cases it's, they're the physicians and, the medical, they're just overwhelmed.
Yes.
They might be behind the times, things like that. I was talking to somebody just yesterday who had moved and she has lupus. And she said she is having the hardest time finding a new doctor, and I said, well, I mean, that would have been one of those where I would have checked before I moved, but,
I love that you bring that up
when she might not have had a choice.
That's a whole other issue for your employees.
Right.
It's hard to get primary cares depending on where you live. It's hard to get into the first step. And now you're talking about our participants. Our participants are difficult when it comes to their health, their conditions, sometimes their interactions with their doctors, because they know I'm not doing what I should be doing.
Right.
I don't love going to my doctor. Some of them get dropped by their primary care and they don't have one. And now they're seeing a physician's assistant instead of a full medical doctor, which sometimes that can be fine, but sometimes that's a real issue. Again, one of the things we like to do that's very important is we build a relationship with the provider community. We are definitely non-adversarial.
Right.
In fact, we talk about ourselves being the ultimate extender. You would like to spend more time with this individual. We get to. So let us do it on your behalf. So we develop those relationships, and then it allows us over time to say, okay, I know you have a closed practice, but this individual, she's making progress. He's making progress.
Right.
If you can open it up to take that individual, that would mean a lot. And you're really going to impact somebody's life in a big way.
Right.
It's very rare that somebody's going to say no to that, because these doctors do want to have an impact.
Right.
They really do want to help people, especially the ones that we believe are the most skilled, the most efficient, it's because they have a passion for it. So we would like to get these people that have critical needs into those individuals. And so we find ways to do it, which is a whole thing that if we're not there, that participant is even at greater risk, because now their healthcare becomes urgent care. It becomes the ER.
And then the expenses skyrocket.
Through the roof. Right. Through the roof.
Right. Well, and, having that advocate, and that's one of the things that I tell people, who are in my position, you absolutely have to be advocating for yourself. And if you are unable to, you need to have someone else. And with one of mine, I developed gallstones. Might have got them no matter what, but and now I knew I had them because I'd been in the emergency room and I'd had the ultrasound and they went, ew. And so they sent me to the specialist, and actually they said, you need to be in within a month. Here's who we're going to send you to. So I called and they said, our first opening is 3 months. And I said, yeah, but the ER told me I need to be in our first opening is 3 months. And now I kind of mock, but I shouldn't. I mean, they have they are told you do not work anybody in. You can't, they're following the instructions they're given. And I said that 3 months is not going to work. So, got a different doctor who could see me within about a month, who did not take the time to read my very lengthy epic chart. And so he had no idea what was even going on. Right. And he lectured me. He shook his finger at me. Now that doesn't go over well, right? And I mean, I have people who actually think I am now medically trained because I have so much, knowledge from having to deal with all of this. And, and he said, here's change your diet, yada, yada, yada. Like they tell people with gallstones. And he said, come back in a month. I come home, I call my surgeon, and which is very bizarre that I have my own surgeon, but and I went in, he took one look at the scans and he said, we're getting you next week. And so, I had my gallbladder out. I was a happy little camper, but I still kept that appointment with the specialist. So I go bebopping in and he said, are you feeling better? And I said, why, yes, I am. He still had not looked at my chart. And, and he said, well, see, what I told you worked. And I said, no, what worked was getting my gallbladder out 2 weeks ago.
Right.
And he was like, oh my, and I said, do you ever, and I was not, I said, do you ever read somebody's chart before you walk in? And then, I've had the opposite happen where I have made an appointment with a specialist and I play Dr. Bingo, right? Is how many specialists can I get? This is one of my, he's my doctor now forever because I had my thyroid gland taken out. So this endocrinologist, he gets me forever. He messaged me before my appointment with questions. Mm-hmm. Ding, 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 ding. Right. But I know enough to advocate on my behalf. But even at that, there have been times where it's like, and so to have someone in your position, that's just incredible because like you said, the questions to ask. It's very strange here in Georgia. We have urgent care. I mean, every place I think now has urgent care, but we now have a lot of standalone type of things. So standalone MRIs, cardiac, all of these things. Now I prefer to do that in the hospital.
Everybody's favorite dialysis centers.
Yeah. Oh yeah. They're like on every other
cheap.
corner. And so you have those in there. So that comes back to what you were saying before with the costs, it's, good or bad. When you had a hospital to go to, there was cost X, but now you've got all of these different options and pretty soon it's who can get me in first. That's where I'm going to go.
And it's not even your choice. It's what your doctor is prescribing. Right. He's referring you out.
Right.
So you're just saying, oh, but he has no concept of cost. No. It's not their fault. They don't understand, and they are not privy to that. This guy that I met at this medical conference, who's in my area, who does MRIs, happens to be the most expensive one.
I have his pen.
Right. He does a great. His radiologist does a great job. Well, that's wonderful. However. Maybe the cost of the MRI is 20% higher, which that can be fine too. Again, we always look at the episodic cost. You don't get hung up on the units. You want to know like, okay, yeah, I had a knee done and it was, $10,000 or $15,000, but you know what? It had complications and admissions and all kinds of things. Whereas the other guy that maybe the knee was 30,000, had no complications, great rehab and great results. Long term, the costs are lower by paying it up front, and going with that better surgeon. But there's very little knowledge, even amongst those who are going to refer you, as to who is the best. And by design, I mean, I don't begrudge the hospital systems, but they have to make money. They're not going to.
They're not. They
tell
might
you
be a nonprofit.
This is our best.
But they have to make money.
Best surgeon. So try to get into him, and if you can't, then we got this guy that's got now a ton of availability because we told everybody that he's not very good. That's just not going to happen. Or they're
new. There's a variety.
Or they're new.
Yeah.
Right. Or they're new. But people develop those reputations and there's some understanding, but you got to look at the claims data. You got to see the histories of what do their needs look like.
Right.
Right.
Yeah.
And,
Are they, and you
how
know, are they
their
having a lot of repeats? I mean, that's one of the
right.
biggies,
Oh,
you know, especially with,
exactly.
say, an orthopedic surgery, you know,
Oh,
are they having
exactly.
to have hips redone?
Hmm.
You know,
And
things
how
like that.
quickly? Yeah.
Mhm. Right. Yeah.
Right.
10 years.
Right.
Okay. That was probably the a good time frame for that hip to
Right.
last.
We had a
Mhm.
diabetic who, before he came on board with us, had to have a part of his limb amputated. That's part of the
Oh.
reason why he decided to come on
Mhm.
board and join
Mhm.
and participate.
Mhm.
Um, and difference between even getting
Mhm.
prosthesis
Mhm.
fitted.
Right.
This guy was having
Mhm.
sores. He was having all kinds of issues
Mhm.
because they went to
Mhm.
kind of the place that their doctor had
Mhm.
recommended, and it was a nightmare.
Mhm. Right.
Took him to another prosthetics place, and
Mhm.
instantly problem's gone.
Right.
Right?
Well, and we as patients don't often go back to whoever referred and say, that was not good.
No,
You
no, there's
know?
no feedback. No,
Mhm.
there's no
Yeah.
feedback.
Yeah. And but I'm sure they would like that. I mean, really, if we, you know, said, you know, hey, Dr. X, you need to know that you sent me to a place that this and this and this went wrong.
Well, and
You
then
know,
we allow you not to have to do
mhm.
that. So
Right.
we get to be bad cop,
Mhm.
where we're coming in and we're
Mhm.
getting to have the conversation between
Mhm.
two professionals. This
Mhm.
isn't just some lay person
Right.
complaining.
Mhm.
This is a professional coming in and say, by
Mhm.
the way, here's what happens when
Mhm.
you're referring all these people
Mhm.
to surgeon X.
Mhm.
This is what's happening.
Right.
This is what's happening.
Mhm.
And so what I need you to do, if you can,
Mhm.
is refer to Dr. Y, because
Mhm.
Dr. Y, we're having none of those issues.
Right.
And they love that, but they
Mhm.
don't ever get to hear that.
Right. Yeah, because again, they want the best outcome.
Right.
Yeah, they don't want
They
you
do.
coming
They
back.
do.
They, you
No.
know, they don't want things going wrong. You know, and so yeah, they want the best possible outcome too. You know, and so it's definitely a win-win when that happens.
Yeah. And
So when you work, so explain to me more about how your company
sure.
operates. So you go
Yeah.
in and you only do certain people, or I'm a little lost here.
Yeah, I mean, we'll manage everybody to a certain extent, but the true
Mhm.
management, which is meeting up face to face
Mhm.
frequently, is with the
Mhm.
complex. So what we do is we get hired by self-insured companies,
Mhm.
obviously the ones that are bearing the true
Mhm.
risk of their
Right.
healthcare
Mhm.
costs. We look at their claims data. We go through.
Mhm.
We sort and triage
Mhm.
basically how that all looks,
Mhm.
and then we start reaching out to those individuals. But it's very important. Two things. It's always confidential. We
Mhm.
stress
Right.
with everybody, your
Mhm.
employer's not going to
Yeah,
know what we
the
do.
HR folks are not going to know
Can't
that
know.
you have X. Mhm.
They can't know, because if
Mhm.
they know, that's a huge HIPAA violation, number
Mhm.
one. But number two, it's just not good for your relationship with
Right.
your employer and everything
Mhm.
else. They can't know that.
Mhm.
And you're not going to be a good participant then,
Mhm.
because you're going to blame us
Mhm.
for a lot of other
Mhm.
things that are happening.
Mhm.
So very confidential.
Mhm.
But number two, it's 100% voluntary.
Mhm.
Has to be voluntary. We've got to
Okay.
convince you.
Mhm.
It's like an internal marketing
Mhm.
program. We've got to sell you on joining our program,
Mhm.
because if you don't want to be here,
Mhm.
you're not going to get the benefits.
Okay.
You're
So
not
then
going to
does
make the
the
lifestyle choices.
right. Does the employer then have the true insurance company that is the provider? And then you're working with them, or are you the
Nope.
provider?
We're the provider. We're
Okay.
not actually
Okay.
providing care. We're
Okay. Right.
providing
You,
this kind
yeah.
of
Mhm.
advocacy
Mhm.
coaching type
Mhm.
service. But what
Right.
we're doing is going in, and the first thing we do is we're gonna reach out to you.
Mhm.
We do a very large internal marketing program as
Mhm.
far as making the
Mhm.
employees aware of what
Right.
this benefit
So
is
you're like
first.
really busy right now because it's
Oh yeah.
benefits time.
Yeah, exactly. Exactly. And then we come in and we reach out to those individuals.
Mhm.
Could be a phone call, could be
Mhm.
meeting them in place,
Right.
could be, whatever. We set up a meeting.
Mhm.
Number one, we set up that first meeting,
Mhm.
and we're going to get to know you. We're not going to
Mhm.
talk about your conditions,
Mhm.
because number one, we have to build
That's a
that
little
relationship.
threatening. Mhm.
Yeah, right.
Mhm.
We have to build that relationship. It's
Mhm.
incumbent on us to earn your trust
Right.
if
If
we're
you
going to
came
have
in and
any
said,
impact.
"So, Deb, let's
Right,
talk about your
right.
cancer," I'd be like, "Excuse me?"
Yeah, right, right. Right. You
Mhm.
have to invite us in,
Mhm.
right? And so it's very important, and we're very
Mhm.
good at this. We
Mhm.
come in, and that's why I talk about authenticity.
Mhm.
You got to be real.
Mhm.
If you're running this program and it's just about dollars and
Mhm.
cents, and it's just about getting
Mhm.
throughput, you're going to impact nobody.
Right.
They're not going to open up to you.
Mhm.
You're not going to get past those collateral health mental issues,
Mhm.
and all of a sudden you're just paying for a service that does nothing. But we come in, build the relationships, we bring our expertise, we win you over. And, you know, after we've met with you maybe 2 or 3 times, we start having real impacts. Then all of a sudden you're opening up about, hey, what's going on at home?
Right.
I'm dealing with this stress. I can't eat better because X is happening. And then we talk through that and we say, well, here are the small things you can do. You think you can't exercise. We had an individual once who was too afraid to exercise because his BMI, man, I can't remember. I think it was 52.
Oh, yeah.
52 or 50, very large, right? He thought he was going to die. So we actually sent him in to have a stress test. And the doctor asked him, when did you have your heart attack? He's like, I haven't had one, but I'm gonna. But the stress test showed him he could exercise and he'd be fine.
Right.
And that got him over the fear. And now all of a sudden his life was changed. But you wouldn't have ever found that out in a doctor's visit that's 5 minutes. It takes hours. We meet people, you know, sometimes during the day, but it's pretty much anytime they're available. We can meet them in their house if that's where they feel comfortable. We can meet them at work in a secure location. We can have phone calls. But really, we're there whenever those participants need us. And that's why it's important that we kind of select who's getting the full treatment, as it were.
Right.
So we're going through those high risk individuals, the ones that are generating a lot of claims and have a lot of issues. And we're working down that list, building relationships and bringing their conditions into control, right? We're getting them on less diabetes meds, or sometimes no diabetes meds. We're, you know, reducing their hypertensive meds. But the biggest thing about that is, the cost of the medication is one thing, but they're not going to the ER and they're avoiding that big risk event. So what happens is, after we've been involved long enough with your company, after we've managed enough of your people, and we get them under management, we keep them under management. They're under management forever with us. Once you're part of our program, you're always part of our program. All of a sudden, those big risk events that you were expecting that are just statistically going to happen, they stop happening. You're getting less and less of them. Now you're only getting the ones that, you know, either are very, very rare, you know, that are kind of no claims data would have pointed to that, but it happens. You have statistical anomalies.
The actuaries went, oh.
Right. Or it's your cancers or things like that, that weren't preventable to begin with. But even there, we're getting involved.
Right. Yeah. Because obviously early detection is, you know, one of the biggies.
Early detection is huge, but also how you deal with the end stage. Right. And so depending on the doctor, some of them are dream salesmen, right? Because they really, it's a hard thing to sit there and tell an individual your best option is hospice and pain management. And that's a tragic thing, but it happens. And that's a better option than saying, we're going to throw the kitchen sink at this.
We're going to operate. We're going to do,
You're getting radiation. You're getting chemo. You're getting biologics. You're getting all of this stuff. And by the way, you're going to feel horrible through the entire
You're not going to like what's going to happen, but we're going to keep
your quality of life is going to be terrible, but you might live an extra month. I mean, I don't want to say that it's unreasonable, but it's certainly not the right answer. And when we can be involved, we can help manage that end stage.
And when you can give them the choice, I mean, they might say, I want you to do everything you possibly can.
For sure.
You know, or they might say, you know, it's funny. So years ago, I worked for an oncologist. So I tell you, I worked for the American Cancer Society. So, you know, when I got diagnosed, I'm like, ooh, I know just enough to be dangerous. I loved my oncologist. He was in Denver. And you know, this was 35 years ago, and he had a very different philosophy. And I remember we had, I managed his education programs. We did a lot of outreach programs and, you know, I managed those. And we had this patient, and she was, you know, I remember thinking she was elderly. Now I was, you know, pretty young. So who knows, she might've been 50, but, you know, she was diagnosed with terminal cancer. I mean, it was, and so, you know, he sat her down and he said, here's the choices. He said, yeah, we can make you miserable. He said, and so she picked the and it was the cutest thing in the world, because she decided she was going to go on a round the world cruise. And so what we did was we packaged up her records and sent them with her. And the only reason we did that was because as you know, if you die in a foreign country, it can get really complicated. And so we wanted her to have, or her family to have that information so that, wherever she was, they went, oh, okay, this is what happened. But, and he sent her on her way with a blessing. I mean, he did not try and twist her arm. He did not, but, and I, to me, I mean, that obviously, made an impression, and that's still how I operate. It's, you give everybody the information and let them choose.
Right. And as an economist, we talk about utility, right? Mm-hmm, and utility is subjective. Mm-hmm. So what's valuable for somebody is not valuable for another person. That doctor shouldn't be, superimposing his value system on an individual who may just say, look, I just want to have the best life I can.
I want to go on my cruise
for as long as it's going to be. And after that's done, I'm fine. But giving that option, which allows you to both, again, give the plan member a better experience, right? But also potentially save a lot of money for the company that shouldn't been spent.
Right.
Because you knew it's not going to be a cure, right?
Yeah.
It's funny. I was talking with our medical director today about a certain type of cancer that he's dealing with personally, somebody that he knows. And it's, again, very end stage metastatic, right? And the doctor was like, well, there's a chance. I was like, okay, well, when
there
you look
always
at the research,
is a chance. I mean, that's
when you look at the research, I have a stats background. When you look at the research, I'm sorry, but the 2 people out of 300, right? That those 2 people had a very, very, very different situation than the individual we're talking about.
Yeah.
And the statistics are for this individual are probably closer to 0 than even 2 out of 300. So are you really selling them the truth? Or are you trying to just keep things positive because you want to avoid the tough conversation? Well, we're able to help facilitate that and have that conversation. Be like, well, that we're not saying that's not possible, but here's the facts that we know.
And a lot of it is, like we were saying, education. So many people hear the word hospice, for example, and they think I'm dead tomorrow. I mean, I live in Georgia. Jimmy Carter has now been on hospice for months and is still out and about. I mean, it is no longer they are giving you a different type of and different level of treatment, but it's not death is imminent type of what we were used to. It is, we're going to make you comfortable. We're going to do all of those things. So it's like you said, it is the education piece that is so important.
And that's what's so interesting about, as an employer, when you're dealing with healthcare benefits, when you're dealing with medical issues, the employer, HR certainly doesn't know anything about clinical issues. They don't know how to navigate the system. The person that's actually person that's actually controlling whether there's going to be healthcare spend, the patient, they don't usually know very much about it. And so you have 2 economic actors who are sitting there making a decision on spend that have very little understanding or knowledge. And that's why some of these larger companies will hire a medical director, this and that. But they really, again, they're only dealing with some one-off cases and some auditing of claims, and they're not getting into the real nitty gritty. And
they might see 50 people in a day, depending on what the company is or, the size, all of those things.
Right. Whereas they need a network of resources. What we provide is that network of resources to go out, form those relationships. And it's like, okay, this person needs to do X, Y, and Z to get off of these meds, lower this condition, and get better.
Right.
That person probably knows it too, because the doctor told them.
Yeah, they've been lectured about it, right?
Why aren't they doing it? Well, because there's a lot of barriers there, and you haven't got to know the individual, and you haven't gotten to know their story. And if you don't know their story, you don't have their trust, you don't have a relationship, you're just not going to have an impact.
Right. So, from the employer's side, for providing this benefit, it really is about wellness. And, and like we said, you can lose an employee to, they go to the emergency room, they might get admitted. There's all of this stuff. Or, you can take care of them. Maybe they miss an hour, you know?
Right.
And I mean, that's just, and can you imagine me? And I mean, you can imagine, but for my listeners and viewers, imagine being that employee and knowing, you know,
Right.
now granted, you are thinking, yeah, they just didn't want me gone. But at the same point, you know, it's like, wow, you know, you know, this is good because not only are they not missing work, they're not missing their kids' piano recital and,
Yeah.
you know, this
Everything.
one's football game and all of those things because they are just healthier altogether. And, you know, and I love, you know, when we see that the best companies to work for, they always have those lists.
Yeah.
They
Right.
almost always provide wellness programs,
Right.
you know, to some degree. And some of them, you know, some of them bring in the massage therapist once a week, and you know that counts as a
Right.
wellness
Yeah.
program. Or they have an in-house clinic and things like that. So there's
Sure.
obviously lots of degrees, but yeah, that's like we've been saying. That is such a big benefit to be able to
Yeah.
tell your current and future employees, here's what we've got.
Well, and the unfortunate thing is most of what you're talking about is PR, right? So it's the programs are really great. Again, I'm not going to knock the programs. In fact, we love to leverage wellness programs because if you have it in place and you've got some discounts and this and that, we'll push our participants to use that.
Right.
The problem is without us, they were never going to use that. So I remember being a part of a company and we had the gym discounts and the wellness and this and that. And it's like, well, the joke was the wellness program was for the well, right? The people that were using it were the people that were already healthy and would have done the right things regardless. The problem was the people that wouldn't use them were the ones that needed it. And just because it's there doesn't mean it's going to get used. It's like your biometrics, right? That's a great program. It educates a lot of people. It gives them good information, but they don't do anything with it. Whereas we can take that and we can have that discussion with those individuals. We love to be involved in the biometrics at the employers that hire us, because we can then meet people face to face as it's happening and get to know people that haven't generated claims yet, but they're going to generate claims.
Right.
You know, you can tell based on their numbers and a quick visual that they are not in a good place. And those people usually aren't super happy. They're not glad that they're in that
know
position
that there
and
are
they want
issues.
help. Right. But it's scary to get help. It's, are you going to judge me? Is what am I going to go through? So this is the ultimate, to your point, this is the ultimate wellness benefit, because what we're doing is actually making the people that need to get healthier, healthy.
Right.
And like you said, it impacts their life, but also think about the productivity. So even if they are not heading to the ER, if you've got a BMI above 35 or 40, do you have a lot of energy? Are you sleeping well? Do you have undiagnosed sleep apnea?
So you're going to make mistakes in your work, you know, all of those things.
Or you're dozing off at work because you can't control it. It's not something you want to do. It's not because you're lazy. It's because you probably got an hour and a half of decent sleep last night and you had 35 apnea events, right? And you're struggling. Those are the types of things that they're not seeking the help. They don't understand it. They maybe think that they don't deserve the help or a lot of different things that once you bring a group like Curally in, that's a real benefit to your people, because we're going to unlock the people that truly need it. And that's what I love about our system is it's not just for, the C-suite and the management and things like this. We're doing this all the way down to the lowest level of your employee. So it's a truly equitable, egalitarian benefit that everybody can use, as opposed to, maybe your lowest level employee can't even afford the gym membership, even with the discount. Well, what kind of benefit was that? So it's a benefit for everybody, and it helps you across your entire employee base in terms of retention, in terms of marketing. And we have testimonials that our clients get to use where it's their own employees saying, I can't imagine. I tell all my friends who work elsewhere that, boy, it's great to work where I work because I have this benefit. Look at what they're doing for me. It's a recruiting tool.
Right. Well, and then it carries it further. They go, okay, I'm supposed to be eating better. So person who is cooking my food at home, we need to start eating better. And, and so then, and it's, we need to start getting some exercise. And so they're taking the kids out and they're, doing all of those things. And so there's a cumulative effect also.
Yeah, the total family has an impact. And sometimes we're even having the conversation with that person who's cooking, because maybe that's a difficult conversation for the individual.
Honey, you got to stop cooking with lard.
This is what's happening to your significant other. This is what's happening. And you love and you care for them. We need you to do this. If you can do this, you're going to notice a totally different person. And it's within reason. We can get them there. If you meet us halfway, we'll do the rest of the work.
It's things like, okay, let's not have red meat every single meal. And I say that from your background of, working in the beef industry, right? So we're gonna suggest that you add a pork and a fish. And here's some recipes for you. Things like that. And it's funny because so many people scoff that, well, that's not going to make a difference. But again, it's the cumulative effect. You get everybody doing it.
And it's individual because again, there's not a system that works for everybody, right? Some people do very well on like a ketogenic diet and some people do terribly and their blood work shows it.
Right.
So knowing, what's impacting this person. I'm meeting with them on a regular basis early on in their management, sometimes multiple times a week. What are they like under these situations? Is the advice working? Is it not working? We're getting the real-time feedback. Whereas even if they see a nutritionist, what are they going to see that person once a month? Maybe.
Or they're going to be like me and they lie to them. I'm eating kale for every meal.
Yeah, right. Right. Or they've got kidney issues and they're eating a lot of kale and they don't understand that's high in oxalates and you're going to end up with other issues. So let's cut back on the kale, even though your nutritionist is saying this.
I throw kale out and the rabbits won't even eat it. So I figure kale's just not.
There you go. There you go.
But you've said it several times. It's about building those relationships.
Yeah, it is.
Because, if I say, sure, Jeremy, I eat my kale all the time, you're going to look at me and go, no. But
because we're seeing you more often. When we know you and we've gotten to know you, we know your tells. We know we've had people put in blood sugars that are ridiculous. And we're like, that's not even possible.
Yeah, no, you do not have a blood sugar of 2.
There's nobody with your body fat content and your weight who has a blood sugar at your level. It's impossible. So how about you stop lying to me and tell me the truth?
And let's get it down to that level in a good way.
And their doctors would have that conversation with them, but they get the chance to have it once a year. And it's not very impactful.
And they get 15 minutes with them, if even that.
Right.
And that's the other issue. It is one of the things that I love about my oncologist. They have a big sign on the door. If you have not had all your questions answered, you do not leave this room. And I love that. But you still feel like you got to rush through stuff you go to all of the other doctors and it really is, how fast can we get in and out?
It's the old approach. And, we even ran our manufacturing company a little differently. It's the old approach of throughput numbers, and those always matter, versus the value of the throughput, right? And, I can envision a hospital system, with a Curally involvement that, hey, it's cash payer and you know what, you can have your appointments as long as they need to be, because
maybe
long
they
term,
see
what we're
10
doing
a day, but
is reducing.
Those 10 were absolutely fabulous.
And they were very important. They were people that really needed it. It wasn't, if you're 25 years old and you've got a reasonable BMI and no issues, maybe I don't need to spend an hour and a half with you, but if you're struggling, let's get this real. And that's what we have the opportunity to do, because we're not tied to any systems. You're not paying by the minute for us. You're not paying by the visit. You're paying a flat rate for our product. And we're coming in and saying, look, if it takes 3.5 hours next Tuesday with John Doe, we're going to spend 3.5 hours with them. And it's not going to take him away from company time. We're going to find a way to do it in a way that keeps him productive, but we're going to spend whatever time is necessary until he feels comfortable And you know what? Then we're going to meet with them
Mm-hmm.
again
Yeah.
the next week
Mm-hmm.
to make sure that we stay on top
Mm-hmm.
of that, and that we're held accountable, that they're held accountable, and that
Mm-hmm.
relationship continues to grow.
I love it. Well, oh my gosh, Jeremy, this has been such a fascinating discussion. And, but we do have to wrap up. So this is why I set the timer, because otherwise we'd be going forever. But tell us specifically, how do people find Curally? And what, I know you have, a lot of services, but what are the primary services that you provide?
Yeah, sure. So you go to curally.com, curally.com, and there's a section on our webpage where you can reach out to us. That gets forwarded to a customer service team that relays that message to us. And really what we'd like to sell you is the ability to come in and manage your participants, manage your plan members. Give us a chance to look over your claims data and work on a pitch to you so that we can help bring this employee retention tool, this recruiting tool, this life-changing tool to your employees. And you get to say, I'm hiring somebody that's going to save lives.
Right.
I'm hiring something that is going to change lives and make my employees better. We get to give you the opportunity to say, I truly care in an authentic way about my employees, which is rare. Everybody says they care, but they don't get the chance to show in action that they really do all the time. And this is a really good way to do that.
I love it. So is there a minimum size company that you work with?
It depends. I mean, we've worked on putting some conglomerations together.
Okay.
In the past. We've pitched different things. Typically you're talking about at least 1,200 members in a plan. So that might be minimum size of 800 employees or so, depending on how many plan members, but usually right around there. So they're not necessarily, they don't necessarily have to be very large companies, because you can see, what size employers typically want to be self-insured.
Right.
You quickly have that risk, and you quickly have a pool that's managed, that needs to be managed somewhere in there. But again, there's product options for a lot of different situations if that so fits. And again, it's on our heart to bring a product that can really help your employees.
Perfect. I love it. So how do they connect with you?
Again, go to our website, put in your information, click the button, it sends the information
Type
our
in
way.
there,
We'll reach
I heard
out.
Jeremy. I want to talk to Jeremy.
Right? Exactly.
I love it. Well, Jeremy, this has been fascinating, because it's something that I had absolutely no knowledge about. And so that's always great fun. I like that. Do you have any final thoughts that you want to leave everyone with?
Yeah, I think it's very important, and I've stressed this throughout our conversation, and I don't take it lightly. Authenticity really matters. And even if you're not going to hire on a Curally, the more authentic you can be with your employees, the more you can really treat them as resources that are provided to you for your use, not they're not there on your behalf, you're there on their behalf. The more productive your employee base is going to be. You really have to look at these people as investments. They have lives, they have families, and it's easy. A lot of you are smaller entrepreneurs. It's easy when your organization is small. And we can say from experience of having both small and very large organizations, you're talking 30,000 employees, it quickly becomes very difficult. So if you haven't developed the practice of being authentic with your employees, and we've all worked for people that are not, and we know what that feels like, it's going to be very hard to keep that going forward. And you'll notice it. You'll notice it in the productivity. You'll notice it in the turnover. You'll notice it in the company culture. And company culture is everything. Certainly bringing in a company like Curally can take that to the next level. And we are happy to do a lot of that legwork on your behalf. But try to be authentic. Learn to truly care about your employees and show it in your actions.
Oh my gosh. I love it. I love it. Well, I've been having such a fascinating discussion with Jeremy Vesta. I'm Deb Creer, and until next time, everyone have a great day.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.